these two good Kenyans are kidney transplant recipients. It's Daniel, it's Matthew. She's the latest transplant we did. That's why she's still in a mask for her own protection. Okay. So regarding the insurance, SHA, and what it has done for kidney patients, that cannot be overstated. For kidney failure patients, we have dialysis treatment and we have kidney transplantation. Now, dialysis treatment is life-saving and it's lifelong. The only route out of dialysis is kidney transplantation. NHIF helped in a way because they used to reimburse the transplant surgery, but in a limited way. They used to give about $500,000. Transplantation is a process because there are a lot of investigations you need to do before the transplant, both for the donor and the recipient, to make sure that the organs are compatible. Then after that you do the surgery, but then after that you have to maintain that kidney in a functional state by giving them anti-rejection medications for life, because that kidney that the patient has is a foreign body as far as his immune system is concerned. So it will try everything to reject it. So they need anti-rejection medication. So NHIF had not managed to include the post-transplant care in their package. And when you're talking about costs of about 30 to 40K a month for Kenyan, that was a big barrier to convincing people to transplant. Because you tell them, okay, dialysis is reimbursed by NHIF. NHIF will work with you until the surgery, but then after the surgery, you're on your own. The post-transplant medication is on you. And you know, the consequences of not taking anti-rejection medication is graft failure, and you go back to dialysis. So people are saying, what's the point? I can't afford the treatment. But right now, SHA has now expanded the cover to include post-transplant care. And it's important, I think, for Kenyans to hear from their own so that it can be believable.
My name is Dan Kapucho. I'm a beneficiary of SHA, which is Dan Kapucho. I'm a beneficiary of SHA here in KNH. As the doctor has said, before, after transplant, we used to be on our own. We cater for our medication, which is a bit costly. But when SHA came through, it has really helped us. The cost of medication was coming to around 30 to 40,000. But SHA per month. Sorry, yeah. But when SHA came through, now it has cut the cost half, which is a benefit to us. At least that amount can help me to do something else. Yes. Actually today I was coming for some more medications for this month, which I'm just waiting for approval, then I go and get the medication.
My name is Masi Kamau, a post-kidney transplant 2 months ago in November here in Kenyatta. Mimi niko tu na furaha sana because of SHA, because I could not afford the whole surgery cost and the post-treatment, but SHA paid for me and my donor about 1 million shillings.
1 million.
Yes.
So you and
my donor, yes. So I didn't pay anything.
When was that?
In November. Yes. And also, again, for the drugs, I'm not buying the drugs. I'm getting them through SHA every month. So Mimi, I just think it's the best thing we have right now. And now because watu wengine hawana information, I would like Kenyans to get that information. Wasaidike kama vile nimesaidika. Mimi hata patia ruhusa naweza chukua bana niambie watu. Because on behalf of the renal patient, it's really a great help for people who live with renal issues like us, because there are so many. There are so many people who want the transplant, but they could not meet the cost finance. Like me, I had done Harambe's and it was not even, I could not get the amount for me. So for me, I feel it's really a good help. It's giving us new hope that we can still have a better life. What we normally do when the babies are admitted in newborn unit, we normally give them the notification card so that they can also endorse the babies. And the babies will also be discharged through SHA from newborn unit. Yes. Very good. God bless for you. Abraham.
Oh, beautiful.
It's a boy? Oh, she's a girl.
Have you given her a name? We're waiting for consultations. Very good, thank you. Tunatoka mbali. All of us were like, yes. Yes. Pongezi.
Anasimama hapo. In our system and SHA system.
Traffic here is permanently very high. It is received, stabilized, sometimes when others feel because now we are taking care of all the other agents.
At least 450.
Services, they are doing very well.
You enrolled for SHA.
Yes. Only that it can't work, mine can't work.
Why?
I don't know the problem. They told me it
Working
can't.
on system, there's something that is not working.
Yeah, the system.
But it should be
now
fine.
I'm using the one for the husband.
No, congratulations.
Congratulations. Thank you so much.
Sorry, make sure. Yeah, thank you. Somebody can hold it for her. Congratulations. And your name is? Gladys. Thank you very much and wish you all the best.
I can hold for you. We will give it to you later.
Even this one, I think you'll be able to hold. But this is for her. Somebody can hold it for her. Congratulations, ma'am. All the best. Get well.
Just on top of that, to make it a center of excellence, the most unique thing is that, remember, we're warning academically. And most of the time, we have to tell you, students are not trained in real time. So we have all the cameras on the screens, so they can communicate and see what's happening in the other one.
This is not the first time we are trying this. The NAC administration attempted this. It didn't succeed. The Jubilee administration attempted this, it didn't succeed. And because of the previous attempts, this time round, we will succeed because we can learn from the other two attempts what were the administrative, legal, and even procedural constraints that made the other attempts not to succeed. So we are very sure that Taifa Care will work. Universal health care for everyone will work this time round. And I want to assure the people of Kenya that we will continue with this exercise of impact assessment, impact monitoring, not just at KNH. We may have started at KNH today, but we are going to other points of service delivery, level 4 hospitals, level 3 hospitals, level 2 hospitals, because there are, again, challenges that are at other levels of facilities, which are in a different level than KNH. And again, we are addressing those ones, including the hospitals that are under county governments. The national government will work in collaboration with county governments to address those bottlenecks around, especially referrals in level 2 and 3 hospitals, and also around diagnostic capacity of those lower level hospitals. It is the intention of government to make sure that every Kenyan accesses medical services, that every Kenyan accesses healthcare services. It is now 2 months plus since we started out the registration rollout. The numbers are picking up, but they are not good enough. We want to urge every citizen of Kenya to register under the Social Health Authority so that they can be beneficiaries of Taifa Care. It has a better package because from the impact stories that we have heard from some of the patients, especially critical patients of critical illnesses, those who have undergone kidney transplants and heart-related diseases treatment. This Taifa Care offers a better package, especially for post-transplant treatment cases. In many of the cases, I have been informed by the patients themselves that the process of getting services is fast, outpatient, and even inpatient. And even the approvals for the bills is taking a very good record time. The East Africa Kidney Institute, which I have said is ready, is a center of excellence for renal care for this region. So it's going to be an international standard facility for renal care. It's going to offer not just dialysis services, but also kidney transplant services, cutting down the expenses, the logistical nightmares of many, many patients from Kenya who have had to travel out of this country for kidney transplant and other related services. So it's going to be a one-stop shop for all renal treatment related healthcare services. And in a few weeks' time, it will be commissioned. Actually, the claims, many of them have been paid for under SHA, except where there are small administrative issues. I think that bit is okay. But the facilities, many facilities are still having a bit of issues because of the historical debt accumulated under the NHF. That historical debt, the government is also trying to offset incrementally because, again, the resources may not be enough for us to do everything at once. So we are committed to deliver this program.